Om Swastiastu, good morning. We are from SGD B2, the second semester of PSSKPD 2021. Today, we would like to present our student project presentation which title is Marine Animals Bites in Children. Before we start, I would like to show our members that will do the presentation. And now, let me introduce myself. My name is David Christopher Tjandra. My last three digits of student number is 066. Now, I would like to explain the introduction part of this student project. As children who like to explore the outside world, they often meet various animals in many places. One of the animals that children often meet, especially for those who often visit the sea, are marine animals that can bite. Apart from the children, people who are at risk of being bitten by marine animals, namely fishermen, swimmers, swimmers, and boaters. Based on the data from the Victorian Emergency Minimum Dataset, 205 injuries were identified and males predominated. However, until this period, there is no data showing the epidemiology of marine animals bites in children. There have been about 2,000 species of marine animals that may cause serious illness and death, one of which is the sea snake. Bites of marine animals can have a dangerous impact, especially on children. Some marine animals have poison. If children are bitten by marine animals, they must be immediately taken to the hospital to be treated by medical personnel. That's all from me. Thank you. Next.
Good morning, my name is Fernando Ghosali and my last digit of student number is 036. Now I'll explain about our problem formulation. Problem formulations are what marine animals are able to bite children and how are their classification, what are the clinical implications of marine animals biting children, and what are the handling and treatment management of children who are bitten by marine animals. And the objectives are to describe marine animals that are able to bite children and their classification, to know the clinical implications of marine animals biting children, and to describe and understand the handling and treatment management of children who are bitten by marine animals. And for the benefits, for the public community, introduce the public about marine animals that are able to bite children and their classification, inform the public about the clinical implications of marine animals biting children, increase public knowledge about the handling and treatment management of children who are bitten by marine animals. For the institution are adding sources of knowledge about marine animals that are able to bite children and their classification as a learning material to introduce students about the etiology and causes of marine animals bites in children, improve the quality of learning material about marine animals bites in children. And for the academicians, this paper can be used to expand medical study knowledge about marine animals bite in children, improving literacy skill and conducting research, especially in researching information about the clinical manifestation of marine animals bites. And students will increase their medical resources about the urgent treatment management when someone is bitten by marine animals. That's
Good morning, my name is Nyoman Ayu Widhiani with three last digit of the number is 070. Now I will explain about the definition of marine animals that can bite. Dangerous marine animals can be divided into two groups, namely marine animals that bite and marine animals that sting. Marine animals that bite, especially large fish or snakes, such as sharks and barracudas, cause wounds with massive bleedings, often causing death due to blood loss. Trauma from attacks by stinging marine animals is usually causing problems from the release of toxin when they sting, and if the reaction is severe, it can cause death. So that's all from me. Thank you.
Good morning, I'm Nevinne Nathania Susanto. My last three digits of student number is 051. Now I'm going to be explaining the classification of marine animals that can bite. First, there is the sea snake, which are reptiles that are often found in tropical marine waters. Next is the tiger shark or Galeo cerdocuvier. Tiger shark is the species most frequently identified in this incidence of Hawaiian shark bites and tiger shark. The size of the mouth of this animal is so large that it can bite humans. Next, there is the moray eel. Moray eels are marine animals that can attack humans and children because moray eels have sharp teeth and large jaws that can attack and bite humans. Next, there's the great white shark. These marine animals can bite humans and cause wound infections. Great white shark lesions can be a source of infections such as Vibrio. Then lastly, there's the sea louse. These small marine animals live on the seabed and can bite human feet and hands. That is all from me.
Morning, I'm Komang Ayu Widhiani. My last three digits of student number is 044. Now I'll explain about etiology of marine animals bite. One example of an animal bite comes from a reptile species living in marine regions, namely sea snakes, as most sea snakes are usually mild unless they are provoked. The incidence of sea snakes bites is much lower than that caused by terrestrial venomous snakes. Even though the incidence of snake bites caused by sea snakes is low, they have a significant amount of neurotoxicity in their venom, which can bring the death rate to as high as 50% if victims are not treated quickly and correctly after being bitten. The principal important neurotoxic components of sea snakes venoms are 3-finger toxins or 3-FTXs and phospholipase A2 or PLA2. That's all from me. Thank you.
Good morning, my name is Yovilia Putra. My last student number is 050. Today I will tell you about the effect of marine animals bite in children. The immediate and lasting impact. Body weight, circulating volume, and motor organ function in children result in higher absorption, distribution, and concentration of sea snake venom in children. Local effect will occur immediately after the bite and spread proximally. For example, a burning and throbbing pain. Swelling will vary obvious in just 50 minutes, become massive in 2 to 3 days, and last up to 3 weeks. In addition to local reaction, sea snake venom can cause headache, stick tongue, thirst, sweating, vomiting, and intravascular hemolysis. In addition to being neurotoxic, sea snake venom also has a myotoxic, can cause myalgia, myopathy, and rhabdomyolysis. Rhabdomyolysis also causes myoglobinuria that appears 3 to 8 hours after the bite. Renal failure may also result from the myoglobin and potassium being released from the damaged skeletal muscle. Vasculitis, glomerulonephritis, and mesangiolisis are direct effect of snake venom. The effect of snake bites also result in segmental myopathic lesion of the skeletal muscle.
Morning, I'm Edgar. My last digit of student number is 045. Next, now explain about disease caused by marine animal bites. Marine animal bites can cause severe blood and tissue loss. Medicines given to treat marine animal bites can cause nausea, vomiting, or stomach ulcers. If not treated immediately, it can cause more serious effects, infection, and severe allergic reactions such as an irregular heartbeat, breathing problems, or coma. Next, pathophysiology of disease. Sea snake venom has been appeared to have neurotoxic, hemolytic, and myotoxic properties. The neurotoxin target postsynaptic acetylcholine receptors, blocking the neuromuscular intersection. Sea snake poison contains a powerful neurotoxin with low lethal dose 50 levels. That's all from me. Thank you.
I'm Gusti Agung Saraswati, 3-digit master number 056. Now I will explain marine animals bite on children. Marine animals bite can cause different physical conditions depending on the species size and whether they are toxic or not. Sea snakes are mostly known for their venom that is 2 until 22 times stronger than cobra. Sea snakes has no toxic tooth attacks. One bite of sea snakes has enough venom to kill 3 adult humans and even more fatal in children. Sea snakes bite of painless and hard to spot in bite live in until 20 marks. The first symptom occurred in 30 minutes and even faster in stronger venom or small children. The first symptoms are double vision, ptosis, and paralysis. That's all from me. Thank you.
Morning, my name is Janice Wijaya. My last digit student number is 037. Now let me continue the presentation with the diagnosis of the marine animals bite in children. In diagnosing a sea snake bite, the first thing to do is to examine the bite site, spot the fang marks or the other local inflammation. Snake bite can be symptomatic or asymptomatic. So for the symptomatic snake bite, sometimes because of the venom toxicity, but it also because of the patient's anxiety that can lead to some unspecific or misleading symptoms. After about 30 minutes of generalized pain, symptoms can be worse. Some bites might be asymptomatic if the snake species was not venomous, dry bites, or when the snake is not injected the venom yet. One is the toxicity of the venom is not that high enough to cause any symptoms and signs. And the last possibility is the envenomed patient don't immediately shows any symptoms. That's all from me. Thank you.
Morning, I'm Ledwin Meikel Wibisono. My last 3 digits of student number is 061. Now I'm going to talk about the handling or treatment of marine animals bite in children. So bites or stings from marine animals usually cause localized pain and do not require treatment, but children are at high risk for a severe reaction. So there are some steps for handling marine animals bite, which are the first one, lie down. People who are stung by sea creatures usually experience dizziness, shortness of breath, and others. So immediately rest the body so that the poison does not spread. And the second one, do not touch the wound. If there is no antiseptic solution, flush the wound with only seawater. Do not be desperate to smear the wound with any medicine unless there is a recommendation from a medical party. The third one, wound compress. If the stinging marine animal's body has been lifted from the body, immediately compress the wound with cold water or clean warm water. And the fourth one, and the final one, keep health control. Go to a small hospital to be first aid. Even though it feels better, it actually still has to go to a big hospital for treatment. If this thing is considered severe, the doctor will usually give a tetanus shot. That's all from me. Thank you.
Good morning. My name is Yovilia Tio Yunus and my last 3 digit of student number is 035. Now I will explain about emergency treatment for a marine animal bite towards children. After being bitten by a sea snake and experiencing inflammation symptoms, the most important thing to do is remove the patient from the water. After the child is moved from the water, the next thing that needs to be done is to secure their airway by installing intubation and mechanical ventilation when needed. Next, administer antivenin into the patient's body so the venom can be neutralized. After emergency treatment is done, continue to monitor the patient's urine output to check for signs of myoglobinemia. Make sure that the patient's creatinine and electrolyte levels are also at the normal range. That's all for me. Thank you.
Good morning, my name is Marta Vitti Lawi and my last 3 digit of student number is 064. So this is our conclusion. Dangerous marine animals can be divided into 2 groups, namely marine animals that bite and marine animals that sting. Marine animals that bite include sea snakes, tiger sharks, moray eels, great white sharks, and seals. Sea snake is a marine animal that has venom with neurotoxic, hemolytic, and mitoxic. Several biological factors such as body weight, circulating volume, and immature organ function in children lead to high absorption, distribution, and concentration of sea snake venom in children. In dealing with cases of venomous snake bites, prompt handling is needed. This is even more important for children because it will cause paralysis of the skeletal muscle and diaphragm. The steps that can be taken to deal with this case are removing the child from the water, then lying on a flat place and making sure the airway is not blocked. Don't touch the wound, compress with cold water or clean warm water, and immediately go to the local health service. The doctor will give antivenin to neutralize the poison and apply immobilization pressure on the bitten area. And the last, ensuring that the patient's creatinine and electrolyte levels are normal. That's all from me. Thank you.
I'm Devasya. My last 3 digits of student number is 016. Now we'll tell about recommendation. The main and crucial thing is for this topic to be studied by scientists or researchers. It needs further study because nowadays children like to explore the outside world. By understanding the classification of marine animals that can bite and its clinical implication, doctor can prevent, detect disease or disorder, and more knowledge can be gained about various treatments that can be developed in the future. This research is also very valuable for us, the writers, in understanding more broadly in the lecture material. That's all from me. Thank you.
That's all for our student project presentation for today from SGD B2. Thank you for listening and giving your attention. Lastly, I would like to close it with a Paramasanti. Om Santi 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 Om. Thank you very much.